So today's topic is about eyelid normal structure and some important diseases related with the eyelid. 2021 Veterinary Sciences. There was one MCQ from the eyelid topic. So if we look at the structures, if this is one eye, then there are one and this is two. Upper eyelid and this is lower lid. The structure of these eyelids, if we look at the structures, then there may be skin with eyelashes that are also known as cilia. Then these eyelids, they are also having muscles, they are also having connective tissue, and these eyelids are also have glands and they are lined with conjunctiva. That is palpebral conjunctiva. So these are the structures which constitute your eyelid, which are having skin with eyelashes, muscles to open the eyelid or to close the eyelid. Some connective tissue is there, glands are there, and lining of the eyelid, that is conjunctiva. Conjunctival lining of the eyelid is called palpebral conjunctiva. If it is present on the eyeball, we call it bulbar conjunctiva. So we'll see this is your upper eyelid. This is your upper eyelid and this is your lower eyelid. The upper eyelid is having inner margin and this is the outer margin. This is the inner margin and this is the outer margin. So these are two eyelids. If we look at this upper eyelid, then the connective tissue of the upper eyelid is called tarsal plate. That connective tissue is called tarsal plate. This tarsal plate is having some glands which open at the inner margin. Inner margin. Tarsal plate is having tarsal glands. Tarsal glands or meibomian glands. This is the outer margin. From this margin, what comes out? These are eyelashes. These are eyelashes. These are eyelashes or also known as cilia. Also known as cilia. So the first MCQ with this eyelid and the eyelashes is this is the lower eyelid. So this upper eyelid, outer margin, this is the outer margin which is having eyelashes. These eyelashes, they are present in dog, they are present in cattle, horse and sheep and peaks. The lower eyelid, it is having few hairs. It is having few hairs. In which species? Horse, cattle, and sheep. In all other species, the lower eyelid does not have any hairs. So dog is written here. It means the dog is having eyelashes in upper eyelid, not in lower eyelid. In these two examples, which species is not written? Cat is not written. It means cat is not having upper lid hairs or not in lower lid. Cat does not have hairs on upper lid and lower lid. There may be some modifications, but true cilia, if we write this term, true eyelashes or true cilia, they are absent in the cat. Cilia or eyelashes in lower lid, they are absent in dog. So these are the species having a good number of eyelashes in the upper eyelid. Why these eyelashes are important? Because after 10-15 minutes we'll see there are some diseases which are related with eyelashes, like hordeolum, external hordeolum, internal hordeolum, or some other diseases. So eyelashes, they are present here. If a species is not having eyelashes, so in that species those conditions will not be found. So these were some important points about upper and lower lid eyelashes. Now something about muscles. Muscles of the eyelid. This is your upper eyelid and this is your lower eyelid. This is lower and this is your upper eyelid. There are 1 and 2. These two are LPS and molar muscle. LPS and molar muscle. These two are known as major elevator muscles. It means these muscles, they help in elevation of upper eyelid. These are major ones. There are two muscles, 1 and 2. They are minor. They are minor. The name of this muscle is frontalis. Frontalis, and the name of this muscle is levator because it elevates, anguli, oculi. So these two muscles, they are minor muscles of for the elevation of the eyelid. So we have two major, two minor muscles to elevate the upper eyelid. Then this lower eyelid is having one muscle attached to it, and the name of this muscle is malaris. The role of this muscle is to depress the lower eyelid. So these are the muscles, that is elevate, it will depress. It means these muscles, they are related with opening of your eyelid. If the examiner asked what are the major muscles which help in opening of the eyelid, so opening muscles major are molar and LPS. Minor are frontalis, levator, anguli, oculi, and depressor. They will help to open the eyelid. So both the eyelid open. There is only one muscle to close our eyes. To close the eyelids, there is only one muscle, and that muscle is this, in the form of a circle. In the form of a circle. This muscle is called orbicularis oculi. The role is to close the eyelid. Close the eyelid. If this muscle contracts excessively, then there may be spasm of the muscle that may lead to spastic ectropion. So we'll see what is that in ectropion topic. But first of all, one, two, three, four, five muscles to open your eyes, one muscle to close your eyes. The muscle which helps in closure of the eyelid is the orbicularis oculi. To open two major muscles, LPS and Muller muscle. Forget these minor, but remember the two. Okay. Then nerve supply of the eyelid. We'll see the nerve supply. Eyelid receive motor supply, sensory supply, and sympathetic. Sympathetic. This motor supply is easy to remember 3, 5, and 7. Sensory is trigeminal nerve branches. Sympathetic is sympathetic. So these are the nerve supply to the eyelid. How this nerve supply is distributed, let's see in the diagram. This is the eyelid. Which muscle? Circular muscle. Orbicularis oculi. Orbicularis oculi. The nerve supply to this muscle is seventh nerve. Because we are studying eyelid, so seventh nerve palpebral branch. Seventh cranial nerve, facial nerve, palpebral branch. Then, after this, there is one minor muscle, frontalis. Frontalis. It is also by the same seventh cranial nerve. Seventh cranial nerve. There was one muscle at the lower side. One that was malaris. Same seventh cranial nerve. Seventh cranial. The most important two major elevators. One was LPS, one was Muller. One was LPS, one was Muller. The nerve supply of these two muscles is very important. In LPS, there are three letters, 1, 2, 3. So the nerve supply is cranial nerve 3, oculomotor. This Muller muscle is supplied by the sympathetic system. Sympathetic. If this sympathetic nerve supply gets damaged, that may lead to a disease called Horner syndrome. Horner syndrome. Horner syndrome means what you are doing, you are cutting the nerve supply to this muscle. Role of this muscle is to elevate the eyelid. That role gone. You are not able to elevate your eyelid. It means drooping of the eyelid. If you are not able to elevate, that will lead to drooping of the eyelid. This drooping of the eyelid is given one terminology that is called ptosis. That is called ptosis. So this is one clinical MCQ asked in one exam. Horner syndrome is related with nerve supply damage of the which muscle? Answer was Muller muscle. So molar muscle is a major elevator of your upper eyelid. Molar muscle innervated by sympathetic. If this innervation gone, lead to Horner syndrome, unable to elevate, it means it will go down, dropping of your eyelid. Clinical term is ptosis. That is related with molar. LPS 3 letter number 3, cranial number 3. These two muscles. Remaining all, they are innervated by your facial nerve, branches of facial nerve. So it's easy to remember LPS number 3, molar sympathetic, remaining all 7th facial nerve. So these were the first topic we discussed about eyelashes. Second was about the muscles and their 3, 5, 7 nerve supply. The third topic, which is most important topic, that is the glands in your eyelid. What are the glands present in the eyelid? If infection happens in these glands, then what terminology is used? If there is no infection, only swelling happens, then what terminology is used? So first we'll see glands. As we know, the basic of gland is there are two types of gland. So in eyelid also these are two types. That may be your modified sweat gland or modified sebaceous oil glands. Example in your eyelid which are modified sweat gland are your gland of mole, and these are two. Gland of G's, and second is the tarsal gland because it is present in tarsal plate, and the another name is the meibomian gland. Meibomian gland. We'll see their location. So first MCQ, they may ask that meibomian gland are modified sweat or sebaceous. So they are sebaceous. So glands are basically two types, sweat, sebaceous. But these mole glands, they are modified sweat glands. Two glands which are modified sebaceous gland, G's and tarsal gland, and the synonym is meibomian gland. Now we'll see their location in the eyelid, where they are located, and what happens if some infection or inflammation may happen. So look at this structure. This is your eyelid. This is the inner margin. This is the inner margin, and this is the outer margin. This is the upper eyelid, and here what is present? Here present tarsal plate. This tarsal plate is nothing but dense connective tissue. In this tarsal plate, there are 20 to 40 glands are present, like this. These glands are known as your meibomian gland. These are longitudinal, these are parallel to each other. These glands. They open at the inner margin. They open at the inner margin. They open here. Okay. This is the outer margin. Outer margin is having cilia. These are the cilia. Near to cilia. See, this is the outer part of cilia, and what is inside? What is this part from where the cilia is coming out? This part is known as the follicle. Follicle of cilia or your eyelashes. Follicle of cilia or your eyelashes. So this dot is, these are the follicles. These are the follicles. So this is upper eyelid. Eyelid is having skin, connective tissue, muscles. We have discussed muscles like LPS, Muller. Then now we are discussing about the connective tissue and gland. The connective tissue is called as tarsal plate. In this tarsal plate, 20 to 40 glands are embedded. Their name is meibomian gland or tarsal gland. These are longitudinal glands lying parallel to each other. They open at the inner margin, that is posterior to eyelashes. Posterior to eyelashes. At the outer margin, we have eyelashes, which is having follicle here. Now, one gland is over, meibomian. There are two glands left. One is G's and the other is the mole. Adjacent to these follicles, here and here and here. At this outer margin, adjacent to follicles, you will find gland of mole and gland of G. So this is the location of your gland of mole and gland of G. And these are your meibomian glands. So here, this is outer margin and this is inner margin. In next topic, I will discuss about their infection or inflammation like things. The terminology, this is the inner margin. This is the inner margin. This is outer or external margin. External margin. Okay. With these meibomian glands, if infection happens with these meibomian glands, what happens? Infection. They are opening at the inner margin. So they are at the internal margin. So that may lead to internal hordeolum. That may lead to internal hordeolum. And similarly, if staphylococcal infection happens, these are gland of G. If staphylococcal aureus infection happens at the external margin, then it is called external hordeolum. External hordeolum, or the synonym is STYE, style. It means infection of this follicle, number one, infection of this follicle or the nearby gland, which is most commonly involved, is the G's gland, not mole. This is not affected by any infection. Either this follicle or the nearby G's gland If staphylococcal infection occur to these two structures, either your follicle or your adjacent G's gland. If staphylococcal infection happens to these two structures, then the terminology is external hordeolum or style. Because they are present at the external margin, so it is easy to remember it is external hordeolum. These meibomian gland, because they are opening at internal margin, so it's easy to remember that internal hordeolum. It means staphylococcal infection of this meibomian gland is called internal hordeolum. So with these glands, I will explain the hordeolum concept. What is hordeolum? Hordeolum means bacterial infection. Bacterial infection. Bacterial infection of what? Of eyelashes follicles. This is important word, follicle. And the nearby glands like gland of G's. So when bacterial infection, which bacterial infection is more common? That is your Staph aureus. Staph aureus. So when Staph aureus bacterial infection happens to the eyelashes follicle or the nearby glands like gland of G's, then this is called hordeolum. So this hordeolum is of two types. It is of two types. One is external, that is also called style, and one is internal. One is internal. Then where is external, where is internal? This is the upper eyelid, inner margin, and this is the external margin. External margin. Here we have meibomian gland, parallel and longitudinal. When the bacterial infection happen at this meibomian gland, they are opening at the inner margin. That is called internal hordeolum. Internal hordeolum means bacterial infection of the meibomian gland. It is called internal hordeolum. What is external hordeolum? This is the external margin. What are structure present there? Follicles with their hairs. These are follicles with their hairs. When infection of follicles, number one. Second, infection of the nearby gland, which are G's gland. When staphylococcal infection happen to these two structures, these two, which are a part of external margin, it is called external hordeolum, or common name is STY style. When internal margin, there are meibomian gland, or another name is tarsal gland. When the infection happen to tarsal or meibomian gland, it is internal surface, internal margin, therefore internal hordeolum. The out of these external or internal. External is more common. External is more common. And internal hordeolum is the rare one. So the things which are external, which are outside, they are more common as compared to the internal. The next thing is the next terminology is the chalazion. Some say chalazion, whatever. So chalazion, the first, there are some important points. This is non-infectious. It means no bacterial infection. Okay. This is non-neoplastic. So this swelling is not tumorous. Okay. Next thing is this is related with tarsal gland or meibomian gland. Meibomian gland. So what is a chalazion? It is nothing but distension or accumulation. Distension of tarsal gland due to accumulation. So distension or accumulation of tarsal gland with secretion. With the secretion. Why there is distension or accumulation of this gland? Because of blockage of the duct. Because of blockage of the duct. So chalazion is non-infectious, non-neoplastic, related with the tarsal gland. It is a swelling, it is a distension, it is an accumulation of the secretion. Why accumulation? Because of blockade of this duct. So what happens in this case? This is the upper eyelid and inner margin. Okay. This is your meibomian or tarsal gland. One more, meibomian or tarsal gland. If you block this duct or this orifice, if you block, the gland itself keep on secreting because the role of gland is secretion. So if you block the orifice, block the duct, the gland keep on secreting. That may lead to accumulation of the secretion. That may lead to accumulation of secretion. If this thing gets accumulated, that may cause distension of the gland itself, swelling of the gland. So this is known as chalazion, where due to blockage of this, secretion keep on secreting and it may accumulate, and that may, this material, when it is incipation, means it becomes dry, it becomes cheesy, yellow color, yellowish white, cheesy or yellowish white material. So the gland is filled with this cheesy material or yellowish white material. It is thickened, distended, swollen. So if this gland, due to over accumulation, there are chances that this gland may rupture. Due to over accumulation, if it ruptures, that may lead to, the gland is filled with sebaceous material, lipid material, that may lead to lipogranuloma formation. So lipogranulomatous reaction will occur because of rupture of the sebaceous gland. So this is the structures related with the chalazion, eyelid, meibomian gland, swelling. So if we compare the three eyelid swelling, first is external hordeolum, or style. Second is internal hordeolum, and third is the chalazion. This comparison is very important. This is more common as compared to internal. It is rare. This external is related with the infection of, this is infection. Which infection? More commonly bacterial. This is also bacterial infection. But chalazion is non-infectious without any infection. Staphylococcal bacteria. This is acute infection. This is also acute. Chalazion is chronic in nature, chronic. If it is acute inflammation, it means it will give you pain. It is painful. This is also painful, but this is highly painful. Internal hordeolum is more painful than the external. This is painless swelling. There is no pain. The gland infected is the gland of G's. Gland of G's. In case of internal hordeolum, these are meibomian gland or your tarsal gland. In case of chalazion, the gland involved, they are also meibomian or tarsal or tarsal. So these are the differences between these three. One more difference with external and internal hordeolum, that is based on the appearance. That is based on the how it appears. The appearance is there is a raised pustule. There is raised pustule on the external margin. Here it is not raised. Not raised means it is small. It means there is small pustule. So there is raised pustule and there is small pustule. So these were difference between three kinds of the eyelid gland affections, where two are bacterial infection, that is staphylococcal, and one is without any infection. After this, we'll see cilia disorders. Cilia disorders. So there are two types of cilia disorder. That may be abnormal, that may be normal. That may be normal. Abnormal are of two types, D, E, and normal are T in the sequence of ABC. So D for dystichiasis, dysthechia, E for ectopic cilia, and T for trichiasis. So these are the cilia disorder, eyelashes disorder, abnormal and normal. So we'll see first with abnormal disorder of the cilia. If we look at first is distichiasis. Distichiasis. This is the cornea, iris, and this is your eye. This is your eyelid. This is your eyelid. This is the eyelid. Distichiasis means we have abnormal cilia. What is abnormal? There is extra row of cilia. What is the source of extra? What is the source of extra? It is coming out from opening of meibomian gland. Meibomian gland. This is the eyelid and this is meibomian gland. So normally, as I showed before, normally cilia comes out from the external margin. From the external margin. If this cilia abnormally they are coming out from the opening of the meibomian gland, then it is called distichiasis. For example, if these are meibomian gland and normal cilia they come out like this. If extra row of cilia, if they start coming out from this point, opening of the gland 1, 2 and 3. So this was the first row, it is normal. But this row which is coming out at the opening of meibomian gland, this is extra. This is extra. So this extra row of cilia coming out from the opening of the meibomian gland, it's called distichiasis. This is called distichiasis. The next is ectopic cilia. Ectopic cilia. The first question is ectopic cilia more common on upper eyelid. These are abnormal cilia. These are abnormal cilia. These are seen in horses. Ectopic cilia. Now, from where they arise, their origin, from where they arise. So they arise from your meibomian gland, your tarsal gland. So what is the difference between ectopic and distichiasis if both are arise from this? The difference is this is the cornea, this is the eyelid and tarsal plate having tarsal gland. Normally they are coming out like this. But in case of ectopic cilia, as the name indicates, it starts with the E. E means these are coming out like E, like this. So it means if this is the opening of the tarsal gland, they are coming just like this. 90° to the cornea. 90° to cornea. In case of distichiasis, they were also coming out from the meibomian gland, but that extra row that was parallel to cornea. That was parallel to cornea. Ectopic cilia originate from meibomian gland opening and they are 90° to cornea. It means they will cause irritation to cornea. That may lead to corneal ulcers. They may lead to corneal ulceration. So here, this is the eyelid, and one more thing, eyelid is lined by the conjunctiva. Which conjunctiva? Palpebral. So when they come out, first they emerge, they pierce this conjunctiva, and they move towards the cornea. And they move towards the cornea. And they irritate the cornea, rub the cornea. Because of irritation, corneal ulcer may happen. So they are more dangerous. So these are ectopic cilia. Third is normal, that is trichiasis. Trichiasis, this is your eyelid. Normally, cilia comes outward like this, like this. But in case of trichiasis, when these normal cilia, they are directed not this side, when they are directed towards the cornea, like this, like this. These are the normal cilia directed towards your cornea. They are called trichiasis. They will cause irritation to the. They will touch the cornea and cause irritation. Irritation. So these are three disorder of the cilia. These are three disorder of the cilia. So if we summarize the three, then this is distichiasis, this is ectopic cilia, and this is trichiasis. In case of this, that was the normal for, but at the opening of these glands, you have one, two, suppose one more gland, and three. You have extra row. You have extra row. But in ectopic cilia, at the base of this, they are coming like E, touching the cornea. They pierce the, this is palpebral conjunctiva, and they move like this. So their direction is like this, E. As the E indicates, they are ectopic cilia. Trichiasis, normally they come like this, but if they move towards the cornea, like this is trichiasis. These are the normal cilia moving towards the cornea. These two are abnormal cilia. Both are coming at the opening of the tarsal or meibomian gland. But it is moving 90 degrees to cornea, and they are making extra row parallel to the cornea. So out of these three, the most dangerous are the ectopic cilia. They may cause corneal ulcers. These are dangerous. And they are found in horses. And these trichiasis, they are common in cat. Trichiasis are common in cat. I will explain why they are common in cat. So, first we'll see congenital diseases. Congenital diseases called eyelid agenesis. Second name is eyelid coloboma. This is a general term. The meaning of it is missing tissue. Tissue is absent. Tissue is absent. Suppose this is the iris, and if tissue is absent here, then this is called iris coloboma. Similarly, if this is the eye, and if and this is eyelid like this. If eyelid is absent at this part, eyelid is absent, tissue is absent, we call it eyelid coloboma. So it's a common term. If tissue is absent in iris coloboma. In eyelid coloboma. So where it is common? This eyelid agenesis, where it is commonly found. It is found in the cat. Very common. Most common in cat and less in dog. So what is eyelid agenesis? Eyelid agenesis or coloboma is absence of portion of eyelid. Eyelid. Which portion? We have, see, this is left and this is right eyelid. This is upper eyelid. Which portion? The portion is lateral 2/3 of upper lid. Mostly it is found in upper. So this is the medial. This is the lateral. Upper means if we divide it in three parts, 1, 2, and 3. So this third, this. So this 2/3 part is absent. Here also, this lateral part, this 2/3 is absent in case of cat. So eyelid agenesis, eyelid coloboma is the absence of 2/3 tissue from the lateral part of upper eyelid that is more common in your cat. The next terminology is ankylo. Ankylo means fusion. Blepharion. Blepharion means eyelid. So in this is a pathological condition, but in case of dog and cat, it is normal and physiological. This is your eye having upper and lower. This is the upper eyelid. This is the lower eyelid. So at birth, there is fusion of upper and lower eyelid. In case of puppies and kitten, at birth they are fused. They are fused. Except this is the medial. This is the medial canthus. This is the medial canthus. There is one at medial canthus pinpoint opening. This is pinpoint opening. Except this medial pinpoint opening, the whole area, both the eyelid are fused in dog and cat at birth. When they will open in 10 to 15 days. 10 to 15 days. They will open. So this is ankyloblepharian. If they do not open, or if there is delay in opening, then this is one eye and this is the another eye. At medial, there is opening, but at this point, both eyelid are fused. Here also both are fused. They may do not open because of infection. In case of dog or cat, Staphylococcus aureus infection may be there. And this infection is known as ophthalmia, ophthalmia neonatorum. So because of this, in case of cat, chlamydia fellis, or one more, feline herpes virus, herpes virus. This infection also found. So when infection is there and eyes are not opening because of infection, that is called ophthalmia neonatorum. In case of dog or cat, Staph aureus is more common. Only in case of cat, chlamydia fellis may be found or feline herpes infection may be there. That is the culprit for non-opening of these two eyes. That is called as ophthalmia neonatorum. Then there are two more terminology. This is the eye, eyeball. This opening is known, these two are palpebrae, eyelid means palpebrae. This is known as palpebral fissure, palpebral fissure. This may be narrow, this may be large. When it is large, the term used is uriblepharon. 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 When it is narrow, then the terminology used is blepharostenosis or blepharophimosis. Blepharophimosis. So this palpebral fissure, it is the opening between two eyelids. If it is closed, if it is completely closed, then we use the term ankyloblepharon, which is seen at birth in case of puppies. Ankylo, both are fused, both eyelids are fused. When they are open, if it is narrow opening, the palpebral fissure is narrow, the term used is blepharophimosis. If it is large, it is called uriblepharon. This large palpebral fissure is most common in Saint Bernard dog. It is most common. Their palpebral fissure is large. So you can see their glow very easily. Similarly, there is lag ophthalmos. There is one condition, lag ophthalmos. What is lag ophthalmos? The definition is inability to fully close the lid. If you remember, in case of pug, the orbit is shallow. Orbit is, in case of pug, the orbit is shallow. But the globe means eyeball, it is prominent. Prominent. If the orbit is narrow, it is shallow, not deep, and your globe is big in size, then you cannot fully close your both eyelid. That is known as lag of thalamus. Very common in your brachycephalic breeds. Very common in like pug. So they cannot close their eyelid fully because orbit is shallow and the globe is big. So the inability to fully close that lid is called as lag of thalamus. This is normal. In case of bug, it is normal. Then there may be exophthalmos. Exophthalmos is not normal, it is abnormal. And it is seen in glaucoma, where increase in intraocular pressure, the eyeball becomes large. That is known as exophthalmos. And this exophthalmos is abnormal. But the lag of thalamus, remember, it is normal because the orbit is shallow because of the natural anatomy of that animal. But exophthalmos, eyes are bulging because of high intraocular pressure, that is common feature seen in the glaucoma. Then what is anophthalmos? Anophthalmos is nothing but your sunken eyes. When there is dehydration, your eyes go inside the. If normally eyes are outside, they will move inside, little inside. That is anophthalmos. So, if we see the globe itself, globe is your eyeball. There are three conditions. This is normal globe. This is normal. If it becomes like this is exophthalmos, exophthalmos. This is the orbit. If the orbit is shallow and globe is big, that is lag of thalamus. Lag of thalamus. That is your exophthalmos, your glaucoma. This is normal. Sometimes it may become less than normal. We call it anophthalmos. Sunken eyes. Eyes go inside the orbit. So eyes may be bulging out, eyes may be bulging in, or eyes may be bulging out, and these two upper lower eyelid, they are unable to cover this palpebral fissure because of these two abnormalities. Means physiological, shallow wrist and big bone. So this was some basic terminology. The next topic is entropion and entropion. Entropion. Out of these two, out of these two, this is clinically, clinically less common.
is common, and this is more common. This is more common. The second difference, this is ectopion is outward rolling of late and margin. This is the outward rolling. If the margin rolled outward, it means there is no chances of rubbing, no rubbing against causing the margin rolled outward, then there is no chances of corneal rubbing, no friction. But in case of entropion, there is inward rolling. Hello, hello. It's not clear. So, inward rolling of the margin. Say if the margin is rolled inward, it means there is rubbing of the eyelashes, rubbing of eyelashes against the cornea. These are basic or small definition or difference of the environment. Now let's say if they ask almost every ectopion, almost every case of ectopion, which eyelid is involved? This is the lower eyelid. Lower eyelid. Sometimes, sometimes upper. Sometimes upper eyelid is involved. In, in case of endothelium, the most common involvement also here, lower eyelid, here also lower eyelid. Lower eyelid. In case of endothelium. But in case of endothelium, the involvement is like this: lower lateral eyelid, more commonly involved than upper eyelid. It is more common than lower medial, lower medial eyelid. So if you look at this lower eyelid, this is the lower eyelid. This lower lateral, this is lateral, this is medial. This lower lateral is most commonly involved in case of entropion. Then, second number is upper eyelid. And remaining, this is the lower, this is the lower medial. So this lower lateral is more commonly involved. Whatever it is lower lateral or medial, the important is lower eyelid, lower eyelid. Lower eyelid is more common as compared to upper eyelid. This is the important. Then ectopion types. Number one, conformational. Conformation means the basic anatomy. Means related with the breed, means breed related. This is most common type of ectropion. Most common ectropion is the conformational or breed related. Why it is breed related and it is most common? Because these breed they have loose skin fold where at their face they have loose skin fold at their face.
Breed-related or conformational anatomical ectropion. Because of the loose skin folds on their face, they have this. The example, which breed, the most example, best example is Saint Bernard. Saint Bernard is the most good example. Second is Labra Retriever. Labrador Retriever. These are. Then the second common number two type is cicatricial formation of cicatrix. That is nothing but scar. Suppose there is one surgery that may leave scar, and this scar undergo contraction. This scar undergo contraction. So contraction of the scar. Contraction of the scar may lead to ectropion. That is known as cicatricial ectropion. One more, the third type of ectropion that may be due to paralytic facial nerve paralysis. That may be due to facial nerve paralysis. So these are some of the common causes of your ectropion. Similarly, one more, this cicatricial is more common in dog and the horses. Similarly, entropion is also conformational because of the anatomy, and it may be spastic. Spastic entropion, spastic term is derived from the spasm. Spasm means excess muscle contraction. Excess muscle contraction. For example, you see the spasm in case of tetanus. In case of tetanus, muscle spasm is there. Similarly, in this case, there is excess muscle contraction. Which muscle? This muscle. Circular. This circular muscle. Name is orbicularis oculi. When this muscle contracts excessively, spasm may be there, that may lead to spastic entropion. That is physiological contraction of your muscle. Then, in both cases, surgical correction. First is ectropion, and here is the entropion. First procedure is known as wedge resection. Means This structure is known as wedge. So taking out a piece of tissue in the form of a wedge. And the more common that cicatricial ectropion. For this, there is one VY Wharton-Jones blepharoplasty, where this is the eyelid incision V-shaped incision is taken, and it is closed in Y shape. The incision is given in V shape and it is closed in Y shape. So this VY blepharoplasty or Wharton-Jones blepharoplasty, this is used for the which type of ectropion? Cicatricial, where scar is there that lead to contraction, that lead to ectropion. For other, the simple technique is wedge resection. We cut a piece in the form of a wedge. There is one more technique, surgical correction. If there is ectropion with uriblepharon means large palpebral fissure. In that case, one technique is used which is known as modified KUHNT Manosky, SGY Manosky. This technique is used for ectropion with large palpebral fissure. So these three techniques are the surgical correction for the ectropion, and for your entropion, in case of young animal, we just put vertical matrix suture, which is called as temporary. This is called temporary tacking suture. So temporary tacking suture are nothing but your vertical matrix suture used in young animal. And the most famous technique, that is your hose celsus. That is your modified or simply hose celsus technique for the correction of entropion. One more important thing about entropion is, as I told, it is inward rolling. Entropion is inward rolling. Inward rolling of what? If there is inward rolling of eyelashes or cilia, it is called entropion. No. The inward rolling of eyelashes or cilia is called trichiasis. And the inward rolling of eyelid, it is called entropion. So these are very important terminology if they are asking about inward rolling of cilia or they are asking about inward rolling of the eyelid. So if only cilia, only eyelashes, the term used is trichiasis, and eyelid entropion. Then at the end, the last topic is eyelid tumor. Most common eyelid tumors. If we see species wise, then in case of dog, meibomian adenoma, most common in dog. In case of cat, squamous cell carcinoma. In case of cattle, squamous cell carcinoma, or in case of horse, squamous cell carcinoma, or equine sarcoid. Equine sarcoid. These are most common eyelid tumors in case of different species.